Without further ado, we'll introduce our first guest to the program. His name is Dr. Jerome Williams. He's the Senior Vice President of Consumer Engagement and practicing interventional cardiologist. He joins us on the phone line right now. Dr. Williams, it's great to have you on the program. Sorry I was so long-winded right there, but you led things off for us here today, which is why I wanted to go through a little history and background of where we were and where we are this morning. So good morning to you, sir.
Good morning, and happy to be here, happy to have this discussion, and happy to discuss healthcare in the communities that we live and serve. And hopefully this will continue to bring information to your audience and to your constituencies.
Yeah, there's no question that we have, just so many questions, I think, as to, well, anytime there's uncertainty and anytime you throw change at us, people immediately, are fearful, and we've got plenty of stress and anxiety going on in our lives. And you add this addition to it, I think there are a lot of questions. But for yourself,
Absolutely.
As the Senior Vice President of Consumer Engagement and a practicing cardiologist, why don't you talk about your role at Novant Health and just introduce yourself to our listeners out there so we can get a better feel as to what you do and why you do it each day.
Yeah, thank you for this opportunity, and once again, happy to be here. Once again, my name is Dr. Jerome Williams, Jr., Senior Vice President of Consumer Engagement for Novant Health, and within that role, I am responsible, and the team's responsible for overall strategic direction of our social responsibility programs, community engagement partnerships, community benefit and community impact and wellness programs across the system. As a practicing cardiologist for the last 30 years now, I will say I only practice one day a week. I'm pretty much a full-time executive, but as a practicing cardiologist, I have a unique lens of the health of not just individuals, but communities. And this is very insightful in terms of connecting with different organizations and communities, and how we build programs, how we build partnerships, and how we address the health needs of specific communities as they arise, and hopefully we'll have a proactive approach to health and well-being.
Now, Dr. Williams, there is a lot of talk these days about health disparities and folks that are kind of left out of the system. And ultimately, you go to emergency care to have to deal with some of the things that, present itself health-wise. And oftentimes these are reoccurring type things. Can we explain to the listeners out there a little bit about, what creates maybe these health disparities and how we can, work to reduce them?
Yeah, absolutely. Absolutely. So when we talk about health disparities, what we're essentially talking about are differences in health status, differences in health outcomes between different groups of people. And these health disparities are often due to inequities that are deeply rooted in society. And these disparate outcomes are often seen in many different areas, not just one area, such as heart disease and strokes and diabetes and things of that nature. When we look at the mission of Novant Health, is to improve the health of communities one person at a time, and it's all communities. And what we're focused on is health equity, and health equity is achieving the highest level of health in an individual without having barriers in the way. And so it's really important when we talk about health care, health and wellness and well-being, that we're looking at the whole community and not just segments of the community.
With that said, Dr. Williams, what role do we as everyday citizens kind of play in that? At the end of the day, no matter how much we can point attention to gaps, disparities, and issues within the system, ultimately we have to have some willingness, education, information to make proper choices that help us one way or the other. How can we get into that realm without focusing so much on the system, but more as individuals, and getting that education and access to things like fruits and vegetables and a healthy nutritional diet that maybe can eliminate some of those types of long-term health issues that many people deal with.
Absolutely. And so when you look at chronic diseases, heart disease, stroke, lung disease, things of that nature, we know that 80% of our health has to do with the environment and behaviors that we engage in, and only 20% has to do with biology or genetics. So if we are really, truly concerned about the health of our communities, then we have to address those 80% of environmental and behavioral types of issues. And so let's talk specifics, okay? And so if we talk about lack of access to healthcare, lack of access to healthy foods, lack of access to upward mobility, that has a profound effect on individuals' health. And so while there may be a number of clinics and emergency rooms and urgent care centers and primary care facilities in certain areas, you have other areas that have no healthcare access whatsoever. And without healthcare access, whether it be virtual access, whether it be traditional brick and mortar, it is very difficult to assess the health and needs of a particular patient. Similarly, this goes for food insecurities. And when we talk about food insecurities, housing insecurities, transportation insecurities, what we're really talking about is the global concept of the social determinants of health. Once again, the 80% of activities that truly impact chronic diseases. And so if you have certain areas, certain communities that have lack of access to fresh foods and vegetables, then it's already a baseline of unhealthy nutrition that leads to further chronic disease. So we have to figure out collectively as a community, how do we reduce those barriers to access to healthcare? How do we reduce barriers to healthy foods? How do we reduce barriers to housing, which is instrumental in one's health and wellness and well-being? Obviously, as you alluded to, there are behavioral issues that we have to also educate our communities on, lack of smoking, nutritious foods and things of that nature, which is an important part of it. However, education is one aspect. Educating and then having access points is another a process that we must be engaged in, creating access points.
Dr. Williams, we live in a very, tempting type of world. There's a lot of, vices out there, as you kind of mentioned just briefly a second ago. Real easy to get out there and, with the means that you may have as well, the socioeconomic means, specifically talking about economics, and in this fast-paced society we kind of live in, very easy to go to that fast food restaurant to pick up the burger and fries rather than spend a little extra time putting together a grocery list and, helping to get to that grocery store to make sure you, along with, the people that live under you in your home, for instance, have that understanding. It's kind of, something that is often lost in the everyday shuffle that we all kind of live in. So when we talk about, the disparities that we see, throughout healthcare, are these types of issues also rooted in that? The systematically, yes, we understand, but some of these things that go on day to day, the choices that we make are very easily related to some of the chronic diseases that we see long term.
Yeah, and I would also say to you that it is not only the fast food that is readily available, but often less expensive, right? So it is more expensive to eat healthier. It is more expensive to eat healthy fruits and vegetables than it is to pick up fast foods. And I guess when you are out in the community, and I'm a healthcare provider and healthcare executive, so I have a different lens. I would say to the community, do you want to be a healthy community, right? And if you truly do want to be a healthy community, what does that look like? Well, does that look like a fast food on every corner or healthy fruits and vegetables on every corner? And then work toward those efforts and outcomes. I would suggest that the vast majority of individuals, if they have a few dollars to spend on a meal for a family of four, right, or buy healthy fruits and vegetables that may only, from an expense standpoint, only able to feed one or two, you're going to go to the least expensive, albeit less nutritious form of food. So I truly believe that community education, community understanding, galvanizing community around a culture of health and wellness and well-being. What do I mean by a culture of health and wellness and well-being? We have to understand that well-being and health is an active process. It's not a passive process, right? Exercising and having places to exercise in safe places, having, once again, the ability to obtain fresh foods, the ability to have a home. If you have a choice between paying for rent and paying for food, you are going to defer and hopefully have a roof over your head. So it's very much a complicated, interwoven process that I feel that as a community, is there a desire? Is there a need? And obviously, from a healthcare standpoint, we're advocating for healthy communities, healthy behaviors, healthy choices that leads to well-being.
Dr. Jerome Williams is with us. He's the Senior Vice President of Consumer Engagement at Novant Health. This is the first of an installation of interviews that we're holding with the executive members of Novant Health, given the news that Novant Health is working with New Hanover County in relation to the future of New Hanover Regional Medical Center. All right, Dr. Williams, as I let you go, with all of this kind of laid out, explain to us what Novant Health is doing maybe in some of the other markets that you serve to help reduce some of these disparities and provide this community type of outlook as to how we all need to be focused in on this ongoing effort to eliminate some of these disparities and create an overall situation where our community is healthy as possible.
Yeah. So first and foremost, we believe that connecting deeply into the community with partnerships is paramount. Why is that? Because many of the answers to the challenges in certain communities are already in the communities. And often if you go in and listen, right, and partner and collaborate, you can create programs and processes to reverse those challenges. And let me give you for an example. We talked a little bit about access to healthcare. Over the last 3 years, we have opened up what we call community access clinics that have been opened up in historically excluded areas to provide direct access to healthcare as opposed to the emergency room. We have mobile medical clinics that go even further out into the communities to bring screening and health services via a mobile unit. We have a mobile food pharmacy as well, once again penetrating deeply into communities that historically have food insecurities and are in food deserts. With COVID-19 in March, we flipped 4 of those units into COVID-19 screening, education, and testing units, as well as mask distribution units, once again, to historically excluded communities. We invest in our community cruiser for immunizations for children going back to school so that they can attend school. Obviously, if you're not immunized, you're unable to attend school, which then creates a cascade of challenges down the line. We have an online tool that's built into our health record. It's called My Community. And My Community is a online a tool that connects individuals to social services. So, for example, if somebody is identified within a clinic setting as having food insecurity or housing insecurity, we're able to make a connection with partners in the community that address those issues, and we have a closed loop communication to see that those individuals are connected to needed services. We partner with faith-based organizations for education and training and screening. And so when we go into communities, each zip code is different. And I would say the foundational aspect of everything that we do in community engagement is to first and foremost listen to the voice of the community, better understand the partners that are already there doing great work in those communities, and how do we partner with those community agencies and partners to create the greater impact that we all espouse to make. The last thing that I want to mention is our Upward Mobility Scholarship Program. We've recognized that within our own workforce, which reflects society, there are challenges. What do I mean by challenges? Upward mobility challenges with a similar type of social determinants of health. And so we created a program where there are medical assistants who aspire to become nurses, but don't necessarily have the pathway to that goal. And we have a program where we've taken medical assistants, supported them through various ways, through not just tuition support, but through coaching, mentoring, and so that they are on an upward trajectory to a registered nurse, which, as many of our listeners are well aware, there is a lack of nursing throughout healthcare. So this not only helps the community in terms of upward mobility, with employment, with individual upward mobility, but also helps our community by bringing needed clinical services to our community. So that's just some of the activities that we're engaged in across our footprint.
I think it's so important that those types of things are laid out, because I know there are just many questions that a lot of people have surrounding where Novant Health is going to take us into the future. Should our county commission sign off on this in just a couple of months? And as you pointed out, I think the collaboration and the strategic partnerships that you are having with the people you serve in communities across our state, I think there's fundamental and so important to improve not only the outlook of what you try to do day to day, at Novant Health, but within our communities at large. We need more collaboration. We need more strategic partnerships, and we need something more than just the details written out on a napkin. We need to take action, and I think you just kind of laid out just a few of the things that Novant Health would provide to help identify some of the issues that we have. Every community, as you mentioned, is unique and has its own sets of issues to identify first, to speak with the people who already have boots on the ground, and then to come up with a plan of action and actually see that action through. I think that is part of the process here that often gets left out. Somewhere it gets lost in all of this. Somewhere there's just a failure to connect the dots on all of those things that I just brought up a moment ago.
Well, Joe, you just used a perfect terminology, connecting the dots. What we believe in Novant, and especially in our community engagement division, is that while we don't own all the problems in communities, we're a healthcare institution, and therefore we need to exhibit leadership. We need to create a platform to convene subject matter experts. We're not subject matter experts in housing. We're not subject matter experts in food insecurities. But I know there are many organizations that we've partnered with in our communities that we're currently in other communities that are subject matter experts. And we're able to use our platform to convene and bring people together so that instead of working in silos, and I love what you just said about connecting the dots, let's leverage the subject matter expertise that's already there, already in the communities. It may require a more robust business plan. It may require some investment. It may require just some paint on the walls. It just depends on the individual organization that we're engaged in. But the point I'm trying to make is that as a large healthcare system that's deeply embedded in communities, we create platforms of engagement, platforms of activity that we can leverage subject matter expertise to create a greater impact. Doctor, it's not just about going at it alone. It's about going at it with partners to create impact.
Yeah, I think that is where the rubber meets the road, in that we have to understand that there is a role that outside of the healthcare system we all have to play, whether you said it before, whether that be faith-based organizations. There are so many great nonprofit different groups around town, in addition to, like you said, just basic food banks and other types of groups that work towards providing access to people across the board. to help create a better and healthy community. Dr. Jerome Williams Jr. with us here this morning. He's the Senior Vice President of Consumer Engagement at Novant Health, and this is part of the first installation of about 10 interviews that we'll be holding over the next 2 weeks with Novant Health to get a better and a clearer picture as to what Novant Health will present to the community should county commissioners sign off on this deal surrounding the future of New Hanover Regional Medical Center, with that decision on the horizon come, I believe October. It is slated to be decided one way or the other. Dr. Williams, it's been a pleasure to catch up with you, and I look forward to future discussions with you.
Thank you so much, and thank you for sharing your platform, because partnerships are not just with healthcare or agencies that support social determinants of health, but this platform that you have to educate, to disseminate accurate, timely information is just vitally important. So I thank you so much for having me on.
I think, lastly, the importance of accurate information these days. We've got so much spin going on in the information and the news and other things that we consume. I think it's great to be able to have access to a person like yourself, other members of your executive team, because these conversations are not easy to come by. The everyday, normal, average Joe is unable to get in contact with someone like yourself on a regular basis and have these conversations. We mass communicating, as they say, Dr. Williams, and I think this provides just such a unique opportunity for us to kind of shine a light on all of the things that you do over at Novant Health.
Thank you so much, and I'm happy to come back.